best of luck with that. Now then, when it comes to diagnosing, treating and managing allergies, there seems to be so much conflicting information out there.
So we are sorting the fact from the fiction now with top allergy doctor, Professor Adam Fox. It's lovely to see you. Welcome
Hello.
back. So first of all, an allergy, just explain what that is.
So an allergy is when your immune system gets it wrong.
Right.
And instead of realising that peanuts or milk or dust mite is completely harmless and just needs to be ignored, it instead actually responds to it. And it's that response and the over-response that can potentially be harmful.
Right.
So what's the difference between an allergy and an intolerance?
So an allergy involves your immune system, whereas an intolerance doesn't. So intolerances can be really unpleasant, but they're not dangerous. Whereas allergies, although most of the time they don't cause very severe reactions, on rare occasions they can cause severe and even very rarely fatal reactions.
So there's many myths surrounding these. People all seem to have an opinion on allergies and what they should and shouldn't be doing. Even today's paper says babies born by C-section have drastically altered gut bacteria, which scientists warns could be why Britain faces an epidemic of allergies. Any truth in that?
Well, we're sort of getting a better understanding now of what it is that seems to be causing this big increase in allergies that we've seen over 30 or 40 years. You've probably heard the theory that we're too clean and that if kids don't get infections or live in too sterile environments that they're more at risk of allergies. And we've sort of moved on from that now. We now understand that the role of the bacteria that live in our gut is much more important than previously thought. What has changed over the last 30 years or so is things like breastfeeding less, more likely to be born by caesarean section, a whole range of other things, more antibiotic use, all of which affects what bacteria build up in our gut. And it's those bacteria that seem to have an important role to play in how we react to things. And as that's changing, that's possibly one of the reasons. And it's an interesting study that's in the papers today, suggesting that if you've had a C-section, that will have an influence on the gut bacteria, and that might then have a knock-on effect on a lot of allergies.
One of the others, I actually think many people believe, in fact, I did until the last time you were on here, and we were off air when you said it's not true. Allergic reactions get worse each time. I believe that. Yeah,
it's a really common urban myth, and it's a really frustrating one because often my patients will tell me that it's a doctor that's told them that. And of course it creates an enormous amount of anxiety because most reactions aren't that severe, but the person who's had it is then convinced that the next one's going to be worse and potentially fatal. And in fact, each reaction is completely unpredictable. Fortunately, most reactions are mild. Sometimes reactions are more severe. Very, very rarely they're fatal, but it's impossible to predict what's going to happen. And that's what makes having and living with a food allergy, for example, so difficult.
What about EpiPens? Because there's a few myths surrounding this. One, some people say if you can administer it yourself, you don't need it. Some people say they're just incredibly dangerous.
Yeah, it's another really frustrating thing to hear because adrenaline in the form of EpiPens or Jext or Emerade, we've got some examples here. These are the ones that patients are advised to carry around with them. That's if they're considered to be at risk of having an anaphylaxis, a severe reaction. And there's an urban myth that somehow it's dangerous stuff. And it's really important to recognise that it's not dangerous at all. And in fact, the advice we always give to our patients is that these are meant for severe allergic reactions. But if you're not sure if that reaction is bad enough, just give it, because it's completely harmless to do that.
Well, I was told, because I'm allergic to bee and wasp stings, I was told that if I was well enough to be able to inject myself, then it wasn't bad enough.
No way. If you've got that sense that something bad's happening, or if you've got any suspicion that your reaction is involving your breathing, so if you're starting to cough, if you're feeling your chest tighten up, if you starting to sort of feel a little bit dizzy, that's a sign that things are progressing in the wrong direction, and I would always recommend getting on and giving the adrenaline at that point.
OK, what about this one? Hypoallergenic dogs are best for allergy sufferers. Is there any truth in that?
Yeah, there's this idea that you could get a pet that isn't going to be a problem if, for example, you've got a dog or a cat allergy.
Yeah, my cat's meant to be hypoallergenic, and my daughter's got a cat allergy, as I discovered yesterday.
Everybody I see in my clinic seems to have a hypoallergenic pet, but they're still there in the clinic with a problem. So although there's different degrees of it, so there are some cats, and it's the saliva that you're allergic to typically, that will shed more of it. If you've got a good-going dog or a cat allergy, you're likely to have a problem. And often what will happen is you're living with the pet and you're sort of getting used to the fact that it's around, and you're getting used to your symptoms. And a story I hear often will be somebody will go off to college or university, they'll be away from home for a few months, they'll come back, they'll see the pet for the first time, they get a nasty surprise because they suddenly notice how much worse their symptoms are.
So let me be a little bit more direct than that then and say, is there any such thing as a hypoallergenic dog or cat?
Not really. Just varying degrees of it.
You can have a mild food allergy?
Have to be really careful with our terminology. If you've got a a real food allergy, then because those reactions are so unpredictable, it's possible to have lots of mild reactions and then from nowhere have a very severe one. So I'm always very nervous when people describe themselves as having a mild or a severe food allergy, because nobody can predict how severe those reactions are going to be. So unfortunately, and again, this is that frustration and difficulty of living with a food allergy, even if those reactions have only been mild, it doesn't mean that the next reaction might not be more severe.
Peanut is the most dangerous food allergy?
So peanut allergy gets a lot of press, I mean, for good reason. It's probably the most common cause of very severe reactions in older kids and in young adults. In younger kids, you've probably seen this in the media recently, milk is the most common cause of fatal reactions. So peanut isn't worse than having an allergy to other tree nuts or milk or fish or a whole range of other things. It really depends on the individual.
And very quickly, we've only got 30 seconds here, you can cure your allergy or asthma?
Often they can be outgrown. If you've got a milk or an egg allergy, it can get better. There's a lot of exciting work going on around desensitization, so treatments to lessen how severe the reactions might be. It's not a cure, though, which is maybe in the future.
We've got so many questions. We could ask you so much more. You have to come back.
Love to.
Yes, thank you very much. Thank you.
Thank you very much. Thank you.